Hello, Pedro.
Hey, Shea.
You ever
Good
talk
to see
me
you,
into
man.
this?
I don't know. Good to see you.
Well, I met Peter when he first came to town when he and his family were the lead buyers on the Padres.
You looking good?
Yeah, thank you. So are you.
Dan's been a great friend to me since my family moved down here 2 years ago. I learned through a dinner at his restaurant that he has type 2 diabetes, and he learned that I have type 1 diabetes. You know, your perfect diet looks like what?
Peter brought a real personal level to it about our responsibilities to ourselves and our families in doing things and not expecting the medical professionals to wave a wand or provide more medication. And he really helped me understand what this disease was all about.
Good morning. Thank you for calling Donovan Steak and Chop House here in La Jolla.
In San Diego, the only thing people really know us for, or me for, is Donovan's. And we do a lot of, and always have since we opened, a lot of charitable work in the community. How are we looking for tonight?
We're looking great tonight, Dan.
So 11 or 12 years ago, I went to Scripps, got a doctor who I just loved, you know, was a good guy, and did all the tests, and he came back and he said, you have really high blood sugar, you're a type 2 diabetic, and you need to get your blood sugar down. So we were vacationing in Cabo San Lucas with friends. I had an issue with my hand that had kind of inflamed, so I went to a clinic to have it looked at, and they ran a couple of tests, and the doctor came in and said, your hand isn't your problem. And I said, really, what's my problem? And he said, you're this far away from a diabetic coma. It was a wake-up call, but I didn't take it dramatically. I'm a pretty calm person, but I made a decision, and that is that I have teenagers. I want to see my kids grow up. So I've got to do something different. And what was that? And it just started with the most simple thing of, well, I ought to lose some weight. So in the course of the last year and a half, inch by inch, I'm up to 58 pounds now that I've lost. There's a noticeable difference. I got to come off a couple of medications as a result.
Have you been doing any practice with your carb counting?
Yeah, a little bit. Well, and I finally came to understand what Scripps Whittier Diabetes Institute could do and got a clue that I really needed to pay attention. I really focused in on the dietary and nutrition part. Like, what is it I really don't understand about food? And that was a big eye-opener for me.
Wonderful blood sugar.
Yeah. And I'm a technology geek anyway, and always want to have the latest and greatest. And instead of taking my blood count several times a day, as I was doing to try to learn what foods do what, now it monitors it continuously.
So exercise, that's what
One of the counselors had commented that 50% of the people that doctors recommend to them don't even return a phone call. And I used to be in that group, and I'm probably most troubled by the fact that I was in that group, because I didn't have to have neuropathy, but I didn't do anything until I had it, and it's not reversible.
It is so important for people with diabetes to manage their disease early on, because we can prevent so many of the complications we see with diabetes. Scripps and Scripps Whittier Diabetes Institute has one of the largest staff of diabetes educators and medical experts that help us conduct education, research, and new innovations in technology. There are more people than ever with diabetes. The numbers have tripled over the last 10 years. And surprisingly, those numbers are increasing for both type 1 and type 2 diabetes.
Well, I was diagnosed with type 1 diabetes when I was 32, which is unusual because over 90% of type 1 diabetics find out when they're teenagers or younger. So it was a shock, and I was quite sick and didn't know what it was, and finally, through a blood test, my sugar level was over 700, and at that time I was rushed to the hospital and put on an insulin drip, and had to accept the education very quickly. Well, I'm the lead investor with the Padres, and as the team is taking batting practice today, it's such a great enterprise to be a part of. It was important to me to find the right doctor and the right hospital to help me, and Scripps has been magnificent. What's been particularly helpful for me is the educational programs, and it's ongoing, and while we all hope for a cure, I think educating ourselves so that we use the latest and greatest technology is something that benefits patients of all ages, of course. Having type 1 diabetes, in my opinion, doesn't prevent you from doing anything. When I used to be taking shots, it's like brushing your teeth. You brush your teeth a couple times a day, you take your shots.
How many times a day are you testing now?
My friend Dan Shea, in contrast, is a technology guy. He kind of inspired me to try the pump. And the pump is something that I tried 8 years ago. I wasn't ready for it. I try it now, I am ready for it. It works, it helps. I'm an optimist as it relates to my health. I'm an optimist as it relates to the Padres. And I'm just so happy to be living in San Diego and to be a part of the community. And I'm particularly happy that I found the people at Scripps to help me with diabetes care, because I expect to be shuffling around this planet for a long time. Hey, good to see you, Shane.
Good to see you.
All
bud.
right, see you
Take
later.
care.